The number of COVID-19 cases in Lagos is expected to rise 120,000 by July. The State's Commissioner for Health, Professor Akin Abayomi, revealed this during a press briefing on Friday. He said the projection is based on the government's model. A hydrochloroquine trial is likely to start soon in the city. What does this mean to many in a country with infrastructure deficit? Did the state wait too long to arrive at this? What more does chloroquine have to offer? Data feeds are coming through in one place simultaneously on all our social media platforms on channelstv.com and on youtube.com/channelsweb. You can follow us live on mobile apps on Apple, Android, Fire and Roku TV. Tweet at Gimba Umar CTV and use the hashtag State of the Nation. Let's get your thoughts in. In the meantime, Nigerians have recorded 3,526 coronavirus cases in the country, as reported by the Nigeria Center for Disease Control, the NCDC. A total lockdown looms due to flagrant disregard of the lockdown easing guidelines. Nigerians flooded the streets on the 4th of May, observing no social distancing whatsoever. The Presidential Task Force is concerned about this development, as it says that it may be forced to have a review of the easing of the lockdown. What does this mean in the face of the growing pandemic with more people infected? The chairman of the PTF, Boss Mustafa, has already made a plea to the traditional institutions and religious bodies to act to stop community transmission of the virus. We'll focus on this in just a moment. It's prime time here in Lagos, and this is State of the Nation. Welcome everyone in Nigeria and the rest of the world. I am Gimba Umar and this is State of the Nation. The total confirmed cases of COVID-19 in Nigeria stands at 3,526. This is spreading at the community level, predominantly with a call by the chairman of the Presidential Task Force, Boss Mustafa, and the Minister of Health, Osage Hanire, asking traditional rulers to join in containing the virus at the community levels where it is prevalent. Ade Benro Adejare is the Awowo of Awowo land in Owu Kingdom in Ewekoro, Ogun State, now joins us here in the studios. I want to thank you so much indeed for joining us on State of the Nation at this time. Being a traditional ruler from Ewekoro, here in Ogun State, just very close by, that's your jurisdiction. What was your immediate reactions on the news of the index case within your domain?
Well, evening, Gimba. I'm not a traditional Oba. I'm a title holder from Iwekoro.
Okay, my apologies.
Which is Ashiwaju Egbeni Oja of Iwekoro. And also, I'm the Otumba Laje of Owu Kingdom in Owu, Ogun State. Well, right from the beginning, we got it all wrong before we got to the state. From the first case of the Italian that came in, we should have shut our borders to contain this. And we're not ready for it. So we found ourselves sleeping. Now that it's happened in Ogun State, but we have a proactive governor, and we have a proactive ex-governor who is passionate about this thing to make sure that certain things are done in certain ways. Similar to what Lagos is doing. You know, so they're reacting fast. But you know our people, education. And to educate them, you need a traditional institution to make sure it is passed down and relates directly with its people.
So what's your strategy now?
Well, the strategy we have, representing Iwekoro and Owu Kingdom, I would say that apart from the palliatives that we give out personally to where the masses are and the underprivileged are, and trying to educate them in our local dialect, which is for them to understand that this is actually good for us. It's not about, they're not sure, they don't want to go to hospital, they don't want to go for testing. Then you have the affluent who believe their own personal doctors should actually look at them. So you can see with the numbers, it doesn't really tally with what is exactly going on. because they have people going to private hospital. So how do you do that? So
if I get you right, is it a bigger challenge for you to convince people to get to the testing centers, as it were, especially for you who will be operating, at least from the expectations from the PTF chairman, you who will be operating at the local government level? Is it much of a challenge to get people to get tested?
It is a big challenge. The education isn't there for them. So you're going to tell them, why? Do they know what COVID-19 is?
So what will you do in this instance?
Well, this instance, we're going all around, right from the local government chairman to the governors, you know, and that's the only way you have to convince them. And also, not only convince them, these people make money daily. So with the closure of the borders and sanctioning of, what do you call it? Times they open and time they close, you know, these people have nothing to do. And then you're also telling them they should go for a test. Come on, Gimba, nobody's going to look at it and say, what am I going for a test for when I haven't even eaten?
Now your task is how to succeed in this.
Yes.
What will you employ? What do you need to succeed in this? You've mentioned education, we understand that. But what else do you need? We're talking about homegrown solutions in this instance. How do you plan to go about that?
Okay, first and foremost, Gimba, right from the president giving the go-ahead to set up the presidential task force, you know, you have the governors and you have the traditional rulers who are the key things, the key to the masses, because they have the following and the blessings from them. Now, if you're not talking, also, I am in talks with some, I don't want to mention their names right now, inwards for people to manufacture a solution, traditional solution, which we are working on. And also, I'm also working with people from Germany who are bringing in things for COVID-19, like there's rapid test, which you get instantly between 5 to 10 minutes, which is my own contribution to the country, you know, because I believe, you know, we have to all piggyback ourselves. Because you see, these people, they don't go to hospital naturally. They believe in herbal way. So we employ on the task force to make sure that these people that do herbal solution to come up with something. I have mine.
Even though the PTF is encouraging this to an extent, they still say that it will still have to go through routine testing by the agency itself. Do you see that as a challenge? If you find something, some kind of cure, and then it's been going, it still has to go on the go testing. Does that work perfectly with you?
It doesn't. It doesn't, because at the end of the day, people are dying every day. Gimba. We all have to be proactive. The president was proactive. He set up a task force. But I mean, Gimba, you can see the whole process. The process is too long before it happens. What happens if it takes 1 month? Do you know how many people is dying every day? We don't even know the numbers anymore. Presidential task force will say this, NCCDs will say this. On YouTube and online, you hear all sorts of stories. We don't have no information.
No, the official information is the one that is coming from the NCDC, and in partnership with the PTF also.
So they say.
They reel out those information. But there is a country, an African country, in Madagascar. You just said it took it out of my mouth. They have a homegrown solution. And the president is able to push that out. I think some other African countries are beginning to request for that,
Gambia.
that medicine. Do you think we should do the same?
I would say yes. While we're looking for our own solution, if there's already a solution right now, like Madagascar, I believe we should. Because you see, the solutions we have here is different from the solution Madagascar will probably be doing. But since it's working for them, I think it's something that we should also look for to come and help Nigerians. Not only that, we can even remodify it and now teach our people that make herbal medicines locally.
Does it seem to suggest to you that this is an ailment, the virus itself, is an ailment that doesn't necessarily need a vaccine, since people are being discharged every other day as more people are still being, contacting the virus?
You see, with the case of vaccine, naturally, a virus is like a flu. It overworks himself out. So eventually, I guess that's why they say isolation for 14 days, But what we need right now is that all the isolation centers, like for Lagos, for instance, they're overpacked. Beds, they don't have. So when you look at it, how are you now going to re-educate these people? You come out and you say you've lifted the ban on restriction. These people are flying all the orders from federal government. You get me? Are you going to be testing people daily? Because if your staff comes in today, is he going to go back home and still take public transport, and you get back to the same situation? We do not have a lot of testing centers that is working in Nigeria. So it is very, very important as we speak right now to go to Madagascar and tell them, please come and help us. There's no pride in this. This is people's lives we are joking with. Gimba, you and I, as we're sitting down here, we're talking, but it could be you, it could be me. I've had friends who are in the isolation centers, and it is not a nice experience. The president has given an order, the presidential committee has given an order, but when you look at it, there's a misjoint from the top to the bottom. Take, for instance, in what sense? In the sense of the palliatives. I'm sure you see it online, and people floating different pictures. You said rice with stone, beans with stones, and all these things that are throwing away food. I say in Ikoyi, you see all the masses and the beggars outside your house. It's a small revolution we're looking at because these people are so hungry and jobless. First of all, they were jobless. Now they are hungry.
Do you think the traditional institution, as well as the religious institutions, can, get to that point where people have that confidence in you, people like you and other chiefs, to as a rallying point to try to see that everybody obeys at least the guidelines to, sit in and even possibly a gradual lockdown, or if it's easing of the lockdown, whichever way it is. Do you think that people have got the confidence in people like you to act in a responsible manner?
Yes, there's a lot of people doing works. I have a lot of friends and I have fellow chiefs. We're all councils of chiefs in Ogun State, Owu there, that are doing their own things. But the hardest thing is how to deal with this thing called hunger. It is tasking. It's a lot of money you have to spend. And the federal government has put this money out. Then I believe that the federal government, as we speak today, they should implement another task force that makes sure what gets to the masses is what they are given. Yes, we have the traditional rulers who, thankfully, are managing this stage right now. I can only speak for Ogun State. You have Senator Ibikunle Amosu, ex-governor, doing all the palliatives and doing all manners to try and make the state complement the state of where Excellency Dapo Abiodun is doing, because him and Sanyaolu, of governor of Lagos State, were the first people to actually quickly react to this situation. But right now, it's getting overblown. And from what we are seeing and what you just said just now, can we really contain it? In my own personal suggestion would be, first of all, let's make sure that hunger is away from the masses.
How long would that take?
Oh, well, if the money is available today and it reaches the masses, we don't know. It's something. You give them rice, you give them beans, you give them whatever the government says you should give them, private donors. And another thing I would like to say is even the private donors, they should stop giving out money. If you want to give out something, give it out in food or give it out in equipment. Like I've been supplying equipment to different local governments in Ogun State and Lagos State. That is my own quarter. And I'm working on the rapid test. Hopefully by next week, it's coming in from Germany. Hopefully by next week, we'll get this thing and I'll flush it to my constituency, which is Ogun State. After that, I'll also look at Lagos State because I'm based in Lagos.
That's a good place to let it rest. We most sincerely thank you, Adegbenro Adejare, the Ogbeni Oja of our land in Owu. Of Owu Kingdom, I beg your pardon, of Ewekuru in Ogun State. Many thanks indeed for talking to us on State of the Nation. When we return, however, we'll go on a short break, and when we get back, the search for a solution to COVID-19 continues. Could mathematical computations show the way forward, as the Lagos State government predicts 120,000 cases by July? Stay with us.